Hello, everyone. Good evening, and thank you for once again tuning in to our National Optometric Foundation live shows where we're trying to educate the public, educate the community about their eyes, their vision, eye care needs. We want to save your vision, preserve your vision, protect the vision, and prevent vision loss. So, the National Optometric Foundation has been doing these live shows since the beginning of 2022, and we do these every month on the third Monday of each month. We have fabulous guest speakers sharing their knowledge and wisdom with our listening audience. And you are in for a treat today. We have a guest speaker that's going to share with us in September on herpes in the eye. A lot of people didn't know that there was a connection there, but there is, and she's going to tell us all about it. I'll introduce our guest speaker later on in the show. The National Optometric Foundation is the financial support arm for the National Optometric Association. And we support the NOA in various ways. We team together and do eye exams, free eye exams, and also partner with sponsors who donate glasses to people in communities who need eye care. We do this each year when we're having our National Optometric Association convention. We go into various communities and provide free eye exams and free glasses, partnering with sponsors such as VSP, who are providing those frames and lenses for patients in the community. We also support students who are currently in optometry school, those who are thinking about going into optometry school with scholarships. Thank you to our lovely sponsors and donors who have been contributing to the National Optometric Foundation and allowing us to be able to do this on a yearly basis all throughout the year for students who are excelling in academics and leadership skills there as well. We also try to support students who are taking their optometry exams. We try to support by going to the optometry school while they're in college and supporting them along the way and educating communities as we're doing here today, churches and schools, and trying to support organizations who are doing great work within their communities there as we try to highlight the three silent killers of your vision: glaucoma, diabetic retinopathy, and hypertensive retinopathy as well there. We do not want these things to rob you of your vision there. So we ask that you link with us, follow us, and support us. We have a website that's available, the nationaloptometricfoundation.com, where you can find out more about what we do. You can see photos on the website as well. We have a Facebook page as well under the National Optometric Foundation. And we also have a YouTube channel where you can follow us and you can see our previous shows that we've been doing since January of 2022 as well. And if you would like to donate to our foundation to allow us to continue to do the great things that we're doing for students in the community and our patients, we have a Cash App, $ protecting the vision, and you can donate to the foundation as well. So thank you all for listening in. Go ahead and grab your popcorn, your favorite drink, because our guest speaker for tonight is one of my great friends. Look, she's my great friend because when I was in optometry school, she was our babysitter, and she did a fabulous job with our daughter. And now she has two beautiful babies of her own, and she loves being a mom. Dr. Sherelle Morrison is who I'm talking about. She's a graduate of the Pennsylvania College of Optometry at Salus University, 2011. And then she remained at the Eye Institute there and did her study and got her residency in pediatric care as well there as binocular vision. She returned to the greater Charlotte, North Carolina area where she practiced since 2012. And she is not only an optometrist, but as I mentioned, she's a mother. She loves to bake and she loves to do music in her free time there. So Dr. Sherelle Morrison, welcome to the show. We're so glad to have you. And I'm excited to hear what you have to say about our topic tonight.
Well, thank you so much for having me. I'm excited to be here.
Absolutely there. And maybe at the end, you'll tell them about that awesome show that you were featured on as well there too, with your baking skills, So
Maybe so. Maybe so. Got to hang in there and see.
So guys, listen up. We are going to go ahead and get started with the show. And Dr. Morrison, I just want you to Tell the listening audience a little bit about yourself as far as how are things for you on a day-to-day basis, on a weekly basis there, what type of patients you're seeing, your surroundings, your atmosphere, your setting in the office there. Share that with us so that we can learn a little bit more about you.
Okay, great. So I practice with my eye doctor in Charlotte, in the Ballantyne area. And I would say on average about 25 patients a day. I work 4 days a week to balance being an optometrist with being a busy mom. And so my days are a mix of, routine exams, contact lens fittings, medical eye exams, and follow-ups, making sure that my patients are well taken care of. I see patients down to age 3 in the office. I see a mix of patients from, like I said, down to age 3 to, I think I had a patient who was 97 recently. So I see a lot of families. It is really fulfilling to have a patient and then they say, you know what, I'm going to bring my whole family to see you. I'm going to bring my husband, I'm going to bring my kids. And so I do end up seeing a lot of families, which is really nice. So getting to treat a wide range of different conditions, from, giving that first pair of glasses to the kid who's in first grade struggling to see the board, to the teenager who wants freedom from their glasses and is a new contact lens wearer, to my presbyopes who've hit 40 and all of a sudden need progressives. And then, my patients who are over 55 and dealing with cataracts and the side effects of some of the systemic things that they have going on that can present in the eye. So I see a mix of patients on a regular basis, and that keeps me really busy.
That's fantastic. And you have a wide range of patients that you
Mm-hmm.
see, their demographics there. That's really good. And it's so beautiful in what we do when we see one patient and we
Mm-hmm.
take care of that patient, and then the family want to see us
Mm-hmm.
as well. It's a
Absolutely.
beautiful thing.
Yeah.
It happened today. We saw a young patient today, and before they left, the mom said, I want to also come here for my eye exams from
Mm-hmm.
now on as well.
Yeah.
So
Yeah.
thank you for all that you do as an optometrist and for the
Of course.
community, educating patients. It's more than just getting a
Mm-hmm.
prescription for
Oh, for
glasses. What we're
sure.
trying to let people know by doing these shows is that we care about the health of your eyes. There's
Mm-hmm.
more to the eye than just putting a pair of glasses or putting some contacts on the eye. And that's
Absolutely.
why we continue to have these different topics so that the public is educated. And tonight, you're sharing with us about herpes in the eye. Wow.
Mm-hmm.
It's
Yeah.
amazing that as an optometrist, you're
Mm-hmm.
able to examine a patient and detect based on maybe what they're telling you
Mm-hmm.
and your findings that they may have an issue with herpes in the eye. So
Mm-hmm. Mm-hmm.
go ahead and let's talk a little bit about how that comes about as you're doing your day-to-day practice, because I know that you have some great things to share with us that's
Mm-hmm.
real life situations. So go ahead, you got the show.
For sure. Okay, so I wanted to talk a little bit about herpes because it is one of those conditions that is stigmatized a bit. So there's basically, I want to talk about the different types of herpes. So there's, of course, herpes simplex, which is the one that most people think of, and you have type 1 and you have type 2. So type 1, interestingly enough, 67% of the global population has herpes simplex 1. It is not the below the belt that everybody thinks of when someone says that they have herpes. It's the type that is spread more oral to oral. It can be acquired pretty much any time in life. It's the type that causes cold sores and things like that. And then there's, of course, herpes simplex 2, which is the below the belt version that people think about that causes more of the genital ulcers and things like that. And it is sexually transmitted. And about 13% of people worldwide have that form. And then the other arm that we think about is herpes zoster, which is basically a reactivation of the chickenpox virus. So if you're my age or Dr. Brown's age, or basically, the older millennial set, all of us, for the most part, anyone, in fact, who was born after or before 1980, or really even later than that, 99.5% of us had the wild type of chickenpox, meaning we weren't immunized as children. The chickenpox vaccine didn't come out until 1995. So most of us had chickenpox, and that virus hangs out dormant in the body and later on in life can be reactivated, and that is herpes zoster. And so when you have herpes zoster, a flare-up or shingles, you can have issues that develop in the eye as well. So it's not just the typical stigmatized below the belt herpes that can cause issues in the eyes. It's the cold sore herpes. It's the reactivation of chickenpox herpes. And all of those things can present in the eye in different ways.
Great information, because I don't think people even knew that there was two types. And you clearly defined the type 1 above and type 2 below the belt, and the different things they have. So I'm sure that people will probably have different signs when they have type 1 versus type 2. And I'm pretty sure type 2 is not coming to you, as far as that's something you're going to detect there. So
no, they're definitely not coming to me first. They're definitely not coming to me first.
Not coming to you.
But yeah, that's true. So, you know, a lot of the patients that I have seen that have issues with herpes in the eye don't come to me thinking anything about herpes. It's not even a thought in their mind. They come to me for a red, painful eye. They come to me because their vision's a little blurry. They're seeing halos, or their vision is fuzzy, that sort of thing. And when I look at the eye, I see signs that this could be caused by a herpetic infection in the body. And so, you know, herpes can affect lots of different layers in the eye. It can give you a dendrite or like an ulcer on the cornea. It can cause an iridocyclitis or an inflammation in the eye. It can cause, you know, issues with the retina. It can affect lots of different parts of the eye. So a lot of times when patients come to me, they just want relief because their vision is blurry, their eye is uncomfortable, and they're not sure why. They just need that medical advice and guidance. The one exception, I guess, sometimes people are familiar more with the herpes zoster rash. They know what that looks like, but their eye is involved. Their eyelid is swollen. They're in a lot of pain. Their vision is blurry, that sort of thing. So they're coming to me for the care of their eye. And interestingly enough, I had a patient, which I shared some images with you, but I had a patient who presented to me because they had the classic herpes zoster rash, but also because their lid was swollen, they were in an immense amount of pain, and they didn't know what was going on. They just knew that it was around their eye, so they came to the clinic for eye care.
Wow. And that is the beauty of going to see your optometrist on a regular basis. If you guys listen to Dr. Morrison, she said patients sometimes come into the office and they have no clue that they have herpes, you know, and sometimes what brings you all into the office is that you're experiencing discomfort, pain, blurry vision. Something is just not right with your eyes. And thank goodness that brings you into the office. Many times we see patients simply because they broke their glasses, but then when they come in, we end up finding that they need attention in another area as well there. So I say that to say this, is that the show is designed to protect the vision. We want to educate the community so that they'll know, go see your optometrist on a regular basis. Dr. Morrison, when do you recommend that people go see an optometrist so that they have their eye exam?
So I tell parents this all the time. I mean, I want to see your kids at 3. I want to see them every year while they're in school. I want to see you every year, even if you feel like your vision is fine. A lot of times I'll have those patients who don't really need glasses for far away. Oh, I have 20/15 vision. I could see a mile down the road, and they're very proud of their vision. But you know, I've had those same patients come in and they have asymptomatic retinal holes, and they're at risk of losing that vision just like that from a retinal detachment from an issue that was giving them no symptoms whatsoever. So it's really that preventative care. The same way you go for your annual physical, even if you feel perfectly fine, so that they can screen you for blood pressure issues, blood sugar issues, cholesterol, thyroid, all of those things. The same way you go for that preventative care, the same way you go for your dental cleanings, even if you don't feel like you have a cavity, you have no tooth pain, is the
Right.
same way that you come annually for your eye exam, because we're checking more than just whether or not you can see. We're really looking at the health of your eye, and also as a result, the health of your entire body as well.
Absolutely. And I speak right now to our colleagues. If you're an optometrist and you're watching
Mhm.
this show, you might catch it on the replay. Please join us in educating your local community, your church family, your immediate family about the importance of going to see an optometrist on a yearly basis. As Dr.
Mhm.
Morrison said, we want to see children by the age of 3,
That's
and
right.
then every year after while they're in school,
That's
so
right.
that we're keeping track of these things and we're detecting things before they get too far along. Many
Mhm.
times, children have things going on with their eyes that cause them not to behave well in school,
All right.
all
Mhm.
because their vision is not 100% together there. And those things can be detected by an optometrist. So please, colleagues, join us. Let's educate the community so that the community will know the importance of getting an eye exam, even if they don't have any problems that they feel is going on there.
Mhm.
We want to prevent losing the vision. We know that there are silent killers of the vision: diabetic retinopathy, hypertensive retinopathy, and glaucoma. And now we're learning tonight herpes
Mhm.
is another myth that can be involved with the eye there.
Mhm.
Dr. Morrison may note that she's going to share some pictures so that you can kind of have an idea of something that she has encountered in the office, and also how it may look when herpes is involved with the eye. The eye is involved with herpes there as
Mhm.
well. So thank you for that recommendation for when eye exams should be done there. So
Of course.
herpes can cause so many different symptoms, and you did highlight some of them. I don't know if you have a list so that people can kind of know, hey, this may seem like this, but it could be herpes, So let's get checked to make sure that if it is, we can get the proper care and follow up and treatment there as well. So if you have those things,
Yeah.
can you highlight those
Of
while
course.
you're
So as I kind of alluded to, it could just be a red eye. It could be pain. You could have sensitivity to light, blurred vision. You can have skin lesions. It may not just be the forehead, but it can also be the eyelid that is involved. And it's usually when you have a herpes type involvement, it's usually one eye and not both. So it does tend to be unilateral or just on one side. But yeah, those types of things, which really are very non-specific symptoms and could be a lot of things. I have had patients present for what we thought, initially just by the history was dry eye syndrome. And sometimes I'll look and I see kind of just some little staining areas that look dry and irritated on the cornea, and think, okay, this is a simple dry eye patient, schedule them for follow-up. And when they come back, those little spots have kind of come together and then formed the classic dendrite appearance. So I think that's another thing that we as docs have to be aware of, is that when you have a patient who's symptomatic in the beginning, and this is something that I always keep in the back of my mind, if I have something on the cornea that looks a little funky and the patient's really symptomatic, but I'm not seeing a whole lot, I'll tell them, okay, we're going to treat it like this, but I want to see you back in a few days. And sometimes it just looks like, a bad dry eye. And so I'll start to kind of think about putting them on a soft steroid for a couple of days with a lubricating drop. And I make sure to tell the patient, we're going to approach it like this, but I do need to see you back, because it is possible that we could start this medication and kind of need to change course if the eye starts to look different. So sometimes, you look at a patient and these symptoms, again, are very nonspecific: red eye, sensitivity to light, blurred vision, pain. Lesions on the forehead are very pathognomonic for herpes zoster, so we wouldn't confuse those at all. But the herpes simplex kind of blepharitis, could be confused with a couple other things as well. So really just coming in anytime something feels off about the eye. And in addition to those, just to put that out there, because we are talking to the public, educating the public, flashes of light are never normal in your vision. new floating spots you always want to get checked. So we always want to be aware of those signs of things that could cause loss of vision or permanent blindness. So never ignore flashes or floaters. But again, just those non-specific signs, your eye just doesn't feel right. It's uncomfortable. Your vision's blurry. You're sensitive to light. You're in pain. Those types of things always need to be assessed. And far too often I'll have patients go, well, this started 3, 4, 5 days ago, and I just kind of waited to see if it was going to get better. Don't wait. If it's bad enough that the thought is interrupting your day, if it's interrupting a task that you have to do, that's a sign that's your body trying to tell you something. So just be sure to come in as soon as you notice those symptoms.
Absolutely. I have a saying and I say, don't delay, do it today. You
That's
don't want
right.
to delay it because it can cause the issue to get worse. And then it
Absolutely.
can be a problem that may take a little bit longer to treat,
Absolutely.
to get resolution. So you do
Mhm.
not want to delay when things are not right with your eyes. Dr. Morrison said, you want to just go in, call your optometrist, and get scheduled for your
Mhm.
eye exam. And one of the great things is follow-up is a important topic when it comes to patient care.
Oh, for
Many
sure.
times we don't see patients sometimes coming back because they start feeling good, the eyes start
Exactly.
looking better. But what do you say about that? Is it important that you see patients back?
Absolutely. Absolutely. Because something may feel better, but just because it's feeling better doesn't mean it's completely resolved. Doesn't mean that there can't possibly be other potential complications from the conditions. You always want to see it through to resolution. Even if you're feeling better, if we've said come back in 3 days or we've said come back in a week, it's really just because we want to make sure that you've reached your baseline again, that your vision is looking good, that your eye looks healthy, that everything's quieted down and the eye is in a good state again. So definitely follow up with your docs.
Yes, I want the listening audience to know you can ask questions tonight. Ask questions. If we don't answer it tonight, we'll respond back in the chat. And I also want to talk to my program managers on the back. If there is a question from the audience, please go ahead and put that question up so that we can get that question answered. Because I know many times there's a lack of understanding. Sometimes there's a lack of understanding just from simple terms such as optician,
Mhm,
optometrist, and ophthalmologist. And
mhm.
that's one of the questions, if I'm not mistaken, Dr. Morrison, that Julie Miller is interested in knowing, are all eye doctors optometrists? And
No,
Dr. Morrison, if you want to go ahead and answer that question,
I
you can.
do. I would love to answer that question. So, just like all squares are rectangles, but not all rectangles are squares, all optometrists are eye doctors, but not all eye doctors are optometrists. So, there's also ophthalmologists that we work very closely with. So, if I have a patient that needs specialty care, okay, if I have a patient who needs a surgical intervention or who needs an injection that I'm not able to give, if it's an injection into the back of the, or toward the back of the eye, then I co-manage with ophthalmology. And the difference between an optometrist and an ophthalmologist, we go to 4 years of optometry school after college and do an optional residency at the end of that. Ophthalmologists go to medical school. They do a specialized, much longer residency, and they tend to have more special, well, they have specialty areas that they help. So I have a retina specialist that I send to, I have glaucoma doctors that I work with, corneal specialists that I refer to. So think about your optometrist like your primary care physician, and think about the ophthalmologist like a specialist that you go see, like a cardiologist or an endocrinologist. So we're all doctors, but optometrists are going to be your primary care doctor for the eye. And then ophthalmologist, if you need specialty care or surgery, that's where you're going to go. And we're going to be the ones to send you there. We're going to co-manage with the surgeon. We're going to be the one who's your advocate, who tells them, this is what's going on with this patient. This is what I feel they need. And then they're going to take care of any surgical intervention or specialty care that you need. And usually send you right back to us for your regular care.
Absolutely. We work hand in hand, guys. It's a team of optometry, uh, doctors, technician,
Mhm,
opticians. We're all working together to provide the care that's needed for you, whatever that
mhm.
care may be. And when that care is beyond the scope of our practice, we have
That's right.
partners who we can send you to who will take it the next leg of the race and help
Mhm.
you with your eye care needs there as well. And Dr. Morrison did an excellent job defining the difference between the eye doctors. I love that, square and rectangles. I got to remember that. I love that. Fabulous there. Now they're telling me, well, before I get into that, I just want to let people know we have Dr. Sherelle Morrison, graduate of Pennsylvania College of Optometry at Silas University, with us today, speaking on herpes in the eye. We're also taking questions from our listening audience there. The National Optometric Foundation, we're having this live show to educate the community, educate the public about their eyes, and we have different topics each month. So you can connect with us on Facebook at our National Optometric Foundation page. We have a YouTube channel as well that you can connect with us there at the National Optometric Foundation. We also have a website, brand new website there. It's beautiful. Go check it out. We have pictures on there as well, nationaloptometricfoundation.com. And if you would like to help us continue to do the great things that we're doing for students and for doctors and for people in the communities, we have a Cash App, $ protecting the vision, that you can contribute to tonight. Even if it's just $5, it helps and it goes along the way. So thank you all. And thank you to our awesome sponsors for all that you do to allow the foundation to pour out into the community there. So back to the show, herpes in the eye. Dr. Morrison, I'm seeing that they're telling me that eye herpes affects 1.5 million people around the world each year. Mm-hmm. And it's one of the most common causes of infectious blindness in the USA and Canada. Wow. So is there more that you would like to caution us about? I know there's no foolproof way to prevent eye infections and herpes, but maybe there are things that people can do to lower their risk of encountering herpes and having herpes in the eye there. As we talk about that, can you talk a little bit on those things?
So one thing I would say is, when it comes to herpes simplex 2, just knowing your status is very important, so that you can be aware of whether you need to manage the risk of flares and things like that. So on a completely different note, well, not completely different note, but we spoke a little bit about preventative care. Knowing your status is very important. So regularly being screened for sexually transmitted disease. Like I said, a lot of people have herpes simplex 1, which is spread oral to oral. And there's not a whole lot you can do to prevent flare-ups from that. If you are ill, sometimes you'll get a cold sore or you'll have something come along. If you are on steroids for another medication or anything that suppresses your immune system, then that virus can rear its head because it sees an opportunity. But when it comes to herpes simplex 2, it is important to protect yourself for a number of reasons. So again, that is the one that is sexually transmitted. So of course, using proper protection if you are sexually active, and also having routine STD testing to know your status is very important. One thing that I found interesting about herpes simplex 2 is there's kind of a correlation with HIV. It does make it a lot easier to spread or acquire HIV if you have herpes simplex 2. So those two kind of can travel along together. So that was something that kind of stood out for me with herpes simplex 2. So again, knowing your status, being screened, it's very simple to be tested, and you can request that at your primary care physician's office with all of your other standard testing that they do on an annual basis. They can put you on oral antivirals to kind of keep the viral load low and kind of lower your chances of having these breakthrough infections and things like that.
I heard you mention flare-ups because 20% of the time, people who have eye herpes, they tend to have these flare-ups are happening there, and they have another breakout there as well. So we just want you to know you may see flare-ups again. Don't think that the doctor didn't do the treatment properly or anything like that. There's a possibility that you may see those flare-ups. So I'm glad that Dr. Morrison mentioned that as well.
Absolutely. And for patients who do have flare-ups, a lot of times what we'll do is we'll put you on an oral antiviral like Valtrex, and you take that twice a day for at least a year to kind of prevent recurrence. And that kind of tamps that viral load down so you don't have as many recurrences. Very
good. Very good. And then this type 1 that an optometrist will detect and see in the office, you said that 60% have type 1.
Yes, and so type 1 is not the type that's usually stigmatized. A lot of people get cold sores and things like that, and you can spread type 1 very easily. And that's one thing that I think sometimes we need to be very mindful as optometrists to make sure that we're asking when we see these patients with the red eye, well, have you had a cold sore lately? Or do you get cold sores? Because that's one of the indicators that a person may have a history of herpes simplex 1. And a lot of times people who get cold sores don't think about, oh, I have herpes simplex 1. They don't think about it like that. Like, oh, yeah, every now and again, if I'm sick or I'm really stressed out, I do get cold sores. And that's a question that is a really important part of the history because it can kind of lead you down the path toward a diagnosis that involves herpes. Yeah.
Absolutely there. So this is good information. I hope that our audience, I hope you're learning something tonight because we haven't had a topic like this that's deep. We've talked about glaucoma, diabetic retinopathy, hypertension. We talked about Children's Eye Health Month, but this here is a new segue, and I'm so glad to have Dr. Morrison on tonight to share with us this knowledge there so that you are aware that optometrists are the gatekeepers to the healthcare system. There are things that optometrists will see that your primary care doctor may not know that you have. And we can recommend that you have more tests done because of some things that we may see in the back of the eye and the retina. And we want your doctor to follow up with those tests, and we can send that letter over to your primary care doctor. So we work hand in hand, not just with ophthalmologists, not just with our opticians. We also work with your primary care doctors as well, because your health matters to us. And we hope that you have an optometrist that you trust and you have a good relationship with, where when you go to the optometrist, it feels like you're going to see a friend. You're having a great conversation. You're able to ask questions about your vision, and they're able to give you answers as well there too, because we want you to know that it's a relationship business and it's a two-way communication there as well. So as we continue with the show, I know Dr. Morrison mentioned that she has some photos that she wanted to share with our audience, and I'll let you lead into that segment as well.
Okay, so I had a young woman who came into the office in an excruciating amount of pain, basically shrouded, had a scarf over her head and big sunglasses on, and just was in a ton of pain, according to my technician, and was complaining about a rash near her eye. So if we have that photo, we can show kind of the before. It was kind of a very weepy rash. You can see kind of that maculopapular rash that starts off around the nose and kind of arches up and around near the eyebrow. You can also tell, it's a little hard to tell because there's not a comparison photo of the other eye to show, but the lid is also swollen and there's some discharge there as well. This patient was in 10 out of 10 pain, very, very uncomfortable. And of course, because this was located near the eye, was the first stop. So it's always a little awkward when you want to talk to patients about the fact that what they have going on is caused by herpes, or it's associated with a herpes virus, because a lot of my patients, it's really sweet. A lot of my patients come in with their spouses. I see couples that will come in pairs. They want to be examined together. They want to be right across the exam room from each other. And so as I'm explaining, okay, this is herpes zoster. All people hear is herpes. So I always make sure to say, this is not below the belt herpes. This is you as a child had chickenpox, and that virus, even though we recover from it, it hangs out in our body and it can be reactivated. And, you know, in school, we heard a lot about herpes zoster being something that affects the elderly. And so when I first started practicing 11 years ago, I thought, okay, well, if I have a zoster, it's going to be in an older patient, someone who's over 55. But what I found in practice is that it can very easily be someone that's my age, someone that's in their 30s, or someone who's in their 40s. It does have more of a predilection for women than men. And interestingly, a stat that I saw is that Black patients are affected less by herpes zoster than white patients by about 50%, which is interesting. So we will sometimes see these kind of demographic trends in certain conditions. African American or Black patients tend to be more affected with glaucoma. Caucasian or white patients tend to be more affected with macular degeneration, things like that. There's certain things that everyone gets, but then there's these certain little statistics that these conditions have. So again, with herpes zoster, more women and less African American than Caucasian patients. But this patient, like I said, when she came in, was in an excruciating amount of pain, and the husband was kind of speaking for her, giving a little bit of the history that it just came on out of the blue. But that there was an immense amount of pain. So immediately I recognized it for what it was and knew that I would need to start an oral antiviral, and I did that. And although optometrists can prescribe narcotics for pain, and I do have a DEA license, I'm always a little hesitant about prescribing them. And I also know that in a young patient, you do have to rule out the possibility that they could be immunocompromised, and that's why they're experiencing a herpes zoster flare. So I always like to loop in their primary care physician to see if they feel like HIV testing or any sort of cancer workup is warranted, because it is a little unusual, although it can just be idiopathic or not have a known cause for why you get a zoster flare when you're younger. What I did was loop in, and this patient didn't actually have a primary care physician. So that was another thing. I said, you know what? Let's try going to urgent care. So there's an urgent care within walking distance of my office, and they said, nope, we do not do that. So I called actually the practice that I go to for primary care, and they were able to get her in same day. They actually had an appointment open within the hour. So the physician had my chart notes. They knew that she had a zoster flare. They got her on the narcotic for pain. They also put her on a medication that would help with the lingering effects. So if you don't get the proper treatment for herpes zoster, then one of the big complications is called post-herpetic neuralgia. And basically that just means pain that hangs around wherever that rash was. So she was started on pain management by primary care and also that medication to prevent that pain after it resolved. And so by the time I saw her the next day, she was already feeling a lot better because her pain was being managed. The vesicles were still there, but by 5 days later, if you want to bring up the next image. So this was an open eye photo, so I just blacked it out just for patient privacy, but you can see those vesicles have crusted over. Now there's an important distinction to make between the pre-photo, the before photo, and the after photo. When the vesicles are weepy like that, you can spread varicella zoster virus to someone. So if someone hasn't had chickenpox, you can actually spread that virus to them if they touch those vesicles or if they come into skin-to-skin contact with the secretions from those vesicles. So it is important that if you are around children or immunocompromised people or elderly people, that if you have a vesicular rash like that, that is from herpes zoster, that you make sure that you keep your distance, keep your hands washed, keep those lesions clean and kind of covered up or away from other people, because you can spread this while it's still in that weepy active stage. But once it's completely crusted over, then you're not contagious anymore.
Very good information. I know Belford watching one in the audience was saying that you're presenting great information for him because all he ever heard of growing up was below the belt herpes,
Yes.
So you're making an impact, Dr.
Good.
Moore.
I love that.
I knew it would be a great show here for our listening audience there, and telling them that this can be contagious, upon contact there. So you have to be careful when you may be around someone who has that, so that you're not spreading it and you're not getting it as well there too. One of the other good things you mentioned is that you communicate with the PCP, their primary care provider, to make sure that you're giving the best care for the patient, checking in with him or her to see what else may be going on with this patient. Have they had this? What's going on with the patient there? That's key. And that's what I was speaking about earlier, the communication with more than just optician or ophthalmologist, communicating with the primary care provider there. So thank you for also mentioning that as well. And then just knowing that herpes zoster, it's not just for the old, it's for the young.
Right. That's right. We're not spared just because we're not over 55 or anything like that. If you get sick or that sort of thing, especially in this COVID era where, our immune systems, knock on wood, I have not had it, but people who are already down with COVID or their immune system is a little wonky because they're just recovering from COVID, or you have an autoimmune condition that you have to take immunosuppressants for, you have lupus, or you have some other condition where they have you on medicines to lower your immune response,
Right.
then you have to think these things can be breakthrough issues for you, even if you
Absolutely.
are young.
Absolutely. And that's good to mention that. And, just like you said, female more than male, whites more than black tend to have this. But there are diseases out there that we all have a
Mhm,
greater chance of or a greater risk of getting it
mhm.
just based on who we are,
Yep.
and our family history and things of that sort there. And this just happened to be one where females greater than men, and
Mhm,
then whites greater than blacks tend to get this,
mhm,
So, but we all need to stay under the umbrella of a provider who's given us great care, an optometrist who's given us great care, and a primary care provider who's also given us great care there as well.
mhm.
There was a question, Dr. Morrison, I don't know if you saw it there. Let me try to see. I think Julie had a question about prevention of the herpes zoster through shots.
Yes. Okay,
There.
that's a very good question. So there's one called Shingrix that is recommended, and it does lower your risk for having a herpes zoster or shingles outbreak for 4 years post-vaccination. There used to be another one, but it was taken off the market, so it's not available in the United States anymore. It was Zostavax, which used to be available, but as of 2020, that is no longer available for use in the United States. But Shingrix does provide strong protection against herpes zoster or shingles, and then also that post-herpetic neuralgia that we talked about. And so you get 2 doses, and it's over 90% effective at preventing herpes zoster outbreaks and post-herpetic neuralgia. So that's a very good question. So get vaccinated. They recommend if you're over 55 that you get vaccinated for that, for herpes zoster, for shingles.
Very good question there, Julie. I want to thank you all for sending those questions in
Mhm,
because, we know you have questions and we
mhm,
don't want you to be afraid to ask those questions on our live shows. And we want you to continue to tune in to our live shows the third Monday of each month as we share topics similar to this with you there. The topics will be different, the speakers will be different. The speakers will be fabulous, just like Dr. Morrison there. So you guys continue to connect with us on our different platforms that I mentioned earlier in the show there as well. Dr. Morrison, as you're going throughout clinic there and you see patients sometimes they get attached to you, they don't want to leave you. Can you talk about your relationship with your patients there? I know you mentioned that once you see a patient, the family tend to want to come see you as well there too,
mhm.
but how, I don't know if you've encountered this where patients had to move and they're kind of bothered about leaving you and having their care transferred to someone else there.
So, funny story. I was at one of the satellite clinics on a Saturday, and had a patient that drove all the way down from Raleigh. So, for reference, that's 2.5 hours from where I practice, because they moved and they said, you know what, once a year we don't mind. We'll just come down. We'll make a day of it. We'll grab lunch and we'll do our eye exam and we'll go back. We'll go back home. So I have had some patients. I have a patient that I saw the other day. I took over a practice for someone who had been in practice for many, many years and had a very, very loyal patient base. And so this patient actually flew down from Maryland to have their eye exam. So yes, patients do get attached to you. They get attached to their doctors and they want to stick with you. I have moved practices just a couple of times since I've been in Charlotte, and there are some people who have followed me everywhere that I've gone. So I do have patients that I've been seeing for many years, and then again, they have children and I see their children, or they bring their mom, or they tell their cousin. Or I have friends that, I've gone to college with, and they get their eye exam with me and then say, I'm gonna tell my girlfriend, she's got to come and see you. So yes, you do foster these really deep connections with patients. Um, And it's important. They become, people that you care very deeply about, and you want to make sure that they're healthy and they're well taken care of. So yeah, absolutely.
And so I mentioned that because you seem like the type of doctor that really care about your patients and
Hmm.
you slow down to give them that one-on-one attention and
Hmm.
making sure that you're giving the best care to them. So
Right.
there are people probably near you, people who are willing to travel to you, and I
Hmm.
want you to share how can they connect to you at your location if they want to come for an eye exam.
So, a couple of things. So, I do have an Instagram page. It's Dr. Sherelle Morrison. Also, you can go to myeyedoctor.com and search the Charlotte area, and I will pop up. I'm at Valentine East. You can schedule an exam online, which is very convenient. You can pick your date, put in all your information. We'll call you to confirm, and then you're on the schedule. It's very easy. You don't have to call and speak to anyone. You can actually, if you need to reschedule or cancel an appointment, you can do it by text. So it's very convenient. It's very easy to get on my book. And then, like I said, I'm pretty easy to reach. A quick Google search of my name will pull up my office, and you can schedule online.
Yes, absolutely. And I guarantee you that Dr. Morrison will give you a very thorough eye exam. She's a great optometrist. She's a great friend. And I am thrilled that I was able to get her on the show. Wow, this is amazing. I feel that I've accomplished something great here in 2022 by having you on the show.
Oh,
And
thank you. I
and
appreciate
because
that.
you're welcome, and because you're our guest speaker, I want to make sure that you've shared the information that you wanted to share tonight with our listening audience. So if there's any additional information you would like to share, you can do so at this time as we're wrapping up the show.
Okay, so I guess like I said, when it comes to herpes in the eye, don't just think about below the belt herpes. Think about, if you're someone who gets cold sores, before or after you get sick. If you're someone who grew up like me in the 80s and you had the wild type of chickenpox and you didn't get vaccinated. Oh, another thing I did want to mention, vaccination is so important. And a lot of the kids now, like I said, since 1995, the chickenpox vaccine has been available, and the children who receive that vaccine are much less likely to develop herpes zoster than children who did not receive that vaccine, or children who got the wild type of chickenpox. So if it's available to you, I would strongly encourage you to, of course, follow the vaccination schedule set forth by the pediatrician or your primary care physician. Take advantage of vaccines that are available to you, like Shingrix, if you are someone who is a little older and more at risk for a shingles outbreak. There's no need to go through unnecessary pain or disease that will take. This patient that I saw for the herpes zoster flare was out of work for a full week because it was just so painful. And also, you don't want to be around other people with, a lot of times people come in for issues because they're cosmetic. I see people for styes and their lid just looks bad. They don't want to be around people. So if you don't have to deal with those things, if there are preventative measures you can take, whether it's knowing your status with respect to herpes simplex and being on an oral antiviral that decreases your viral load, or getting a vaccine if it's available to you to decrease the incidence of herpetic eye disease or herpes in the eye, then do those things. And also, like we mentioned, just coming in at the first sign, because as Dr. Brown alluded to, when you come in early and we're able to start your treatment before that virus has had a chance to really ramp up really high, it is easier to manage it, and it does resolve a lot faster and without as many issues as if you wait on it. So don't delay, do it today. And just also, like I said, just stressing the importance of annual eye exams, listening to your doc's recommendations. I know nobody likes dilation. Chickenpox as a child, should I get a chickenpox vaccine? No. So if you've already had chickenpox, it's done. So you have already acquired that virus. It's going to live in your body for the rest of your life. So there's no need to be vaccinated on the back end. But as you get older and are at risk for shingles, then you definitely could take advantage of that Shingrix vaccine. I'm in the Dallas area. Do you conduct virtual eye exams? We do not conduct virtual eye exams. During the pandemic, there was a time when we were doing some virtual type things, but there's really no substitute for a doctor being able to put you behind a slit lamp. And I guess this is a good topic to discuss, because you don't know how many people I have seen who had virtual eye exams, who had virtual refractions, and they can't see out of their glasses, or a problem was undetected because they didn't have someone who could put them in a microscope, really use that magnification, see what's going on. You can't put a dye in the eye to stain and see if there's a herpes dendrite in the eye if you're doing it virtually. So really, when you are doing a virtual eye exam, you have to solely rely on what you can see kind of from afar, and also the history, which if you've ever had something happen and you've had to give a history to a doctor and they say, well, when did this start? And you're like, Friday, Saturday, I don't know, few days ago. But we really need very specific information, or we need to be able to look clinically at the signs and let the signs kind of tell the story. And then that leads us to a more problem-focused exam. Do you accept SC state insurance, being that you are in North Carolina? I believe so. We are so close to the border that I do believe that we do accept, and you mean like Medicaid? We are Medicaid providers, just by the way. A lot of times patients will be hesitant to come in because they're not sure if we accept their insurance, but just call. We're always happy to let you know, or check your insurance and let you know what's covered during your exam. But we definitely accept NC state insurance, and I believe we accept South Carolina as well. But if not, we do have satellite clinics in Rock Hill that would definitely be providers for that insurance as well. Any other questions?
Dr. Morrison, that's great that you guys are open to different type of insurances. And, I think even if you may not take someone's insurance, they'll be glad to be self-pay in order to see you, because they listen to you explain so much information tonight. And now they're connected to you. So there may be someone who may catch this live show later, or you saw it tonight, and you would like for Dr. Morrison to be your optometrist. Feel free to connect with her. And if she doesn't take your insurance, check with your insurance and see if they will reimburse you if you become self-pay. We had a couple of patients today where we didn't take their insurance. We didn't have a contract with their insurance, is what I like to say. And they did pay out of pocket, and their insurance will reimburse them for their expenses there. So there are other ways around. You just have to ask your insurance company to see if they allow you to do that. So just check with them and see, because you may be able to see this great doctor and be under her care for your eye care needs there. So we want to thank you all for those great questions. That was great, especially talking about those virtual eye exams. We've had people come to us because they had that experience and it wasn't great. And when they came to the office, they were like, wow, never again will I do a virtual eye exam.
Right. It's very different. It's not the same experience.
Yes, they felt like they had missed so much because they did virtual versus coming in, and you got one-on-one human contact going on. I'm talking to you right there in front of you, and we're able to, do the things that you say we need to do when you're in the office versus talking to you virtually there as well. So hands down, in person is best recommendation versus virtual there. So thank you for touching upon that. Good questions, great questions there. Any words of inspiration when it comes to eye care and eye health that you want to leave with our listening audience, and then I'll close out the show, Dr. Morrison?
Sure. I just want to say that, of course, when it comes to taking care of your eyes, it's like taking care of the rest of your body. Like I said, preventative care goes a long way. Unfortunately, I've had some patients who come in when it's a little bit too far gone. I had a patient in their 30s who came in with end-stage diabetic changes to the eye and had basically retinal detachments in both eyes, pretty much no vision. And they looked at me with tears in their eyes and said, how am I supposed to work? how am I supposed to take care of my family? And I really didn't have a good answer for that. And it breaks my heart because, a lot of the things that if we catch early, glaucoma, diabetic changes, hypertensive changes, if we catch them early, we can give you feedback on how to manage that along with your primary care physician so that you do have good vision for the rest of your life. And so just being proactive, a lot of times what we do when something scares us, when it makes us nervous, we push it to the back burner. We say, I'm just not going to deal with that because it makes me nervous. But fight that feeling, because a lot of times if we do stay vigilant and we're very proactive about our health, the things that make us nervous are manageable. It's when we ignore them and let them grow into big problems that it becomes an issue. So make sure that you're prioritizing your annual eye exam. If there are people in your life, your parents, your siblings, your children, who are like, nah, I see fine, I don't need to go to the eye doctor. Make sure you let them know too. Hey, let's make a day of it. We can go together. We'll grab lunch after. Encourage people you care about and people that you love to also have eye exams on a regular basis, because you never know what can be uncovered, not just related to your eyes or your vision, but also to your general health and well-being.
I love that. Encouraging the people you love to get an eye exam as well. And it's so great, as you mentioned earlier, to see couples
Oh,
coming
yeah.
in for their eye exams,
It's
see the
really cute.
families coming in. That is just amazing. And
Mhm.
as much as I try to say, hey, sometimes, the wife can go in and then the husband can go in this room, but sometimes they want to be
They
in
want
the
to be together.
same room
Yep.
together. So cute, so cute.
Yeah, it is very
You
cute.
get to witness a lot of sweet things in
Mhm.
the office there. So, folks, continue to take care of your eye care needs. Dr. Morrison shared a wealth of information with us tonight, and it was all good. And you can catch this on the replay. It'll be on our YouTube channel, National Optometric Foundation. Share it with a friend, share it with your family, and then join us again on the third Monday in October to hear our next guest speaker, Dr. Essence Johnson. I almost
Oh,
call her Dr. Essence Robinson because that's who she was when we were in optometry
that's
school.
right.
So, another fabulous show in the making for you. Dr. Morrison, it was a pleasure being on this show with you. Thank you so much for all that you do for the community. Thank you so much for being the great person who you are and sharing with us tonight about herpes in the eye there. I think people learned a lot, and they're going to take this and they're going to go schedule their eye exam. Don't delay, don't ignore it. Do it today. Call your optometrist and get on their schedule for your eye exam. So thank you, Dr. Morrison, there for being on the show.
Absolutely. Thank you for having me. I really appreciate that.
Yes. So, folks, the National Optometric Foundation, we're thrilled to continue to do these shows there. We're the financial arm of the National Optometric Association. You can go to visit our website, www.nationaloptometricfoundation.com. We have our officers on there. You can find out more about what we do. You can see photos on our website as well. And we want you to connect with us. We want you to go and like our Facebook page, National Optometric Foundation. We also would love for you to go and follow us on our YouTube channel, National Optometric Foundation. And then, like I said earlier, if you are feeling generous tonight or later on in the month and you would like to contribute to what we're doing to allow us to continue to do what we do for students in optometry school, those who are thinking about going to optometry school, communities needing eye exams and glasses, you can contribute. We have a cash out $ protecting the vision, and we'll be glad to accept your donation tonight. So thank you again for listening in. Thank you to our generous sponsors. Thank you, National Vision, for giving us grant money to allow us to be able to support organizations who are out there doing great things in their community, educating the communities about diabetic retinopathy, hypertensive retinopathy, glaucoma, the three silent killers of your vision. Thank you so much to all of our sponsors, all of our donors, and thank you, NOA, for partnering with the NOF and helping communities all around the US of A. You guys, we hope to see you on our next live show. The National Optometric Foundation appreciate you. I am the treasurer for the National Optometric Foundation, our president, Dr. Whitehead, and we are truly thankful for all of you for listening in tonight. Hope you enjoyed the show, and I'll see you guys on our next show. Have a good night.